Good day, everybody. Welcome to Dental Voice Season 2 with Zyrus. My name is Rolando Mia, and we're here with, wait till we talk to our good guest. Before we get into that, the purpose of Dental Voice is to hear directly from clinicians, get their perspectives, get their opinions, get their advice to understand all the things that are happening in our industry, in dentistry, and then also provide a kind of their perspective on what's going on. Today, we have Dr. John Comisi. Now, before we get to him, I just want to explain. Dr. Comisi came to Medical University of South Carolina back in 2017 after having had basically 35-year successful practice in New York. He's the founder of Sleep Focused Solutions, and then came to Medical University, the James B. Edwards College of Dental, and he was appointed initially as the assistant professor and course director for the college's operative dentistry. He's also the chair for Oral Rehabilitation and Dental Materials Committee, and very recently, the infection control officer for the College of Dental Medicine. So it's going to be exciting to hear that. Before we get to that, I also wanted to state that he graduated from Fordham University.
Yay,
also graduated from University Northwestern University Dental School. He has been published in the likes of Journal of Dentistry, General Dentistry, Continuing Education, Compendium, Dental Product Shopper, Dental Report, DE, Cosmetic Dentistry. He's a member of 7 different academies and associations, including the Academy of Dental Materials, the Academy of Cardiology, the American Association of Oral Systemic Health, holy cow, International American Association, Sleep Breathing Academy, as well as Dental Biomaterials Science Research Advisory Board, and he's the secretary, treasurer of the South Carolina Dental Association. Holy cow.
Oh, that was really nice. The show is over. Thank you very much.
Well, and finally, he also holds fellowships, Academy of General Dentistry, the Academy of Dental International, American College of Dentists, the Pierre Fouchard Academy, and International College of Dentists. So really excited to hear about your perspectives here. Dr. Comisi, Dr. John, thank you for joining us.
It's a pleasure to be with you, and it's time to go now. That's all done. Thank you very much.
Hold on a second. Good friends with Dr. Harvey Levy, who invented air. So Dr. Comisi, I believe, invented water. So between the two of them, we're alive. So,
Harv, it's all downhill. Trust me.
Well, first of all, thank you for joining us, and I'd like to get right into this. When we entered 2020, we had no idea whatsoever that we were going to be hit with one of the most, I'm going to call it interesting, exciting, scary, anxiety-filled things to ever hit us, COVID-19. Being a member of the dental school, it especially hit that, especially everything that was going on. How is that affecting what you're currently doing? And could you please share your thoughts about COVID-19 and the Medical University of South Carolina's dental school?
Sure, I'd be honored to. It was remarkable, to say the least. It took, we watched it. I watched it back in early December, heard some stories. January came, we started watching what was happening overseas, and as it started to get closer and closer, the college started to prepare because we knew that something was coming. We didn't know what it was going to be. And by the end of February, first week in March, the dean had assembled a COVID-19 task force, which I was a member of, along with 4 other individuals, including the dean, our dean of clinical, associate dean of clinical affairs, our associate dean of student affairs, et cetera. We had an array of wonderful people to start to strategize as to what the college was going to do. And during the first week of March, our spring break had been going on, and we had advised several of our students who were going away on mission trips, because they usually did it at that time, that they might want to reconsider, because we didn't know what the state of affairs was going to be when they returned, or if they were even going to be able to go and come back. Many of them did not go, thank goodness. Some folks went on various spring break vacations, but by March the 13th, we had essentially closed the school. We knew that something was coming, and by the 13th, we realized that there was no way of assuring that our students were going to be safe, that our patients were going to be safe, because of all the unknown variables. So the college just shut down, and we went into overdrive. The task force met 7 days a week, all hours of the day, coming up with different plans. We wrote various policy programs and tried to start to figure it out. We eventually reopened on a limited basis an urgent care facility at the college. We took care of patients, whether they were patients of record or not. They were able to come in and get emergency services taken care of. And we continued to figure it out. Again, luckily, the dental college is part of the university hospital. We're part of the entire university, in which the hospital is a component of, and it helped guide us with the epidemiologists, et cetera, here at MUSC as to what we should be doing. We were in council with them. I was on phone calls and conference calls with the hospital staff 5 days a week at first, and we just tried to figure it out as a team what we were going to do. We determined that we were able to obtain and have the appropriate personal protective equipment, which we still are able to obtain and use, N95s, face shields, the whole 9 yards, full gear. The good part is that dentistry has been prepared because of universal and standard precautions for years, since the HIV challenge back in the early 80s, et cetera. We have been caring for our patients in a manner that has been safe. So adding in some of these extra precautions, instead of just wearing a regular mask, such as this, wearing N95s when treating patients, full face shield glasses, face shields, head covering, impermeable gowns, etc., shoe coverings. We treated our urgent care people. Eventually, we were able to get them tested, and that mechanism rolled through for a while to make sure that everybody was safe. After a while, the testing mechanisms became overwhelmed, and so testing had to stop for a period of time. But yet, we still operated. Why did we operate? How could we operate? Because of our PPE. The personal protective equipment that we use and that is standard or available for the dental profession to care for our patients is there. As long as everybody has the proper garb to wear, we're safe. Our patients are safe. And we look at how we are working intraorally. Well, basically, pre-oral rinses are very important. Currently, peroxide solutions are rinsed off before we see any patient, which is what should be standard all over. That helps to deactivate the virus from everything that we've understood so far. Isolation is critical. So isolation of the oral cavity is critical, and everybody in the college uses one form of isolation or another, including rubber dam, isovac, et cetera, and so forth. And we use it in conjunction with the secondary HVE line. So all of our things are always going on under vacuum, intraoral suction where possible, rubber dam as appropriate, but there's always a second source of HV, high volume evacuation going on in there at all times. And that's what's been helping us to minimize any kind of aerosolization, any kind of spatter going on, et cetera. We have identified that. And in fact, we're in the process of paper submission for the techniques that we have investigated thus far, and hopefully have that published very soon in a peer-reviewed journal that we can all be very comfortable with. But dentistry has been and will continue to be a safe arena as long as the appropriate precautions are taken. We're at almost 75% or greater patient attending to the school as we were last year at this time. So we have figured out a way here at the college on how to make sure that patients feel safe, students feel safe, faculty feel safe, everybody, our hygienists, et cetera, and so forth, are our various residency programs. Everybody is following our clinical infection control protocol that we developed, and we're keeping people healthy and safe. We have not had an incident as far as transmission in the school, knock wood. We'll continue to have that happen, my hope is. And again, as long as everybody follows the clinical protocol that we have established here at the college, and people are doing what they can out in the field, we're going to be in good shape. We're going to be able to muster through this extraordinary event of 2020.
Awesome. Thank you for that. It's amazing. There was so much information. How did you separate what was real, especially when you look at modes of transmission, fomites, droplets, aerosols, the three different categories? How did you handle those? And can you share kind of where you ended up with regard to your opinions or what you believe each of those three different modes of transmission and how you're handling those?
Well, again, I'm very fortunate to work with some of the most intelligent and brilliant minds in the world. Dr. Michael Schmidt, who's one of our really foremost microbiologists, infection control authorities in my mind. I learned so much from Michael all of the time. We started to analyze the surface disinfectants that we had and made sure that all of our disinfectants complied with CDC guidelines, looking at the N formula guide to make sure that it was on the list, on the N list. So we established that right away. We started to consolidate and make sure that everything in the entire college was uniform. We established infection control protocol, which is very important because infection control is an interesting thing. We have all kinds of surface disinfectants out there. Some of them say that you can clean everything with one wipe. Sorry to say to the industry, there's no such thing as a single wipe disinfectant out there. You have to clean and then disinfect. My wife, Karen Comisi, who is an infection control guru herself, taught me that years ago when she was running our practice as the infection control officer there. I learned everything I know from my wife. So I'm very fortunate in that manner. And, we realize that, you can't, if there's any kind of stain, any kind of debris, you've got to clean the surface first, even if it's just clean. If you're cleaning it with the disinfectant wipe, that's step one. Then you got to clean it with the disinfectant to disinfect it. That's step two. So it's a two-step process. It's no such thing as a single wipe anything that's out there. And I'm sure Aurella Christensen would agree with that, and everybody else, and Michelle Strange, who's been on the program with you as well, would all agree that you need to make sure that you, A, follow directions, and B, follow directions.
So as far as it seems that people or information indicates that fomites, hard surfaces, and droplets, it's pretty clear. The one that seems to be the most nebulous is this idea of aerosols and whether or not COVID is carried in there. From a CDC, from our governing bodies, there's been conflicting information. They've even submitted and then retracted that. What is your position or your opinion with regard to aerosols and the potential for airborne transmission of COVID-19?
That's one of the mysteries right now. We don't have a complete understanding or knowledge of it. We can only speculate. And my job as the infection control officer for the dental college is to speculate on the side of overwhelming concern. So I have to think about the lives of the 75 members per class, so that's 300 students, plus our residents, plus our staff, plus our faculty. I would rather err on the side of safety than throw caution to the wind. So basically surface disinfection, air circulation, all of these are very, very important. You're supposed to have between 6 and 8 air exchanges in your operatory areas frequently in order to make sure that you at least have a clean circulation. That's hard for a lot of places. We will, after each procedure, of course, disinfect each and every treatment room that we use, and we have a lot of them. And before we start the next patient, when the next student would come into the room, depending on the scheduling, every student and every doctor and every resident wipes the office down again because of the potential for the settling of whatever's in the air. So we clean after we're done, and then we clean once more before the patient is seated. And then we can go ahead and do all of our appropriate infection control and PPE donning and doffing, etc. And then at the end, again, clean it, disinfect it.
Okay.
Next person comes in, clean it and disinfect it before you seat him, and then do it all over again. Until we have either a cure or a vaccine, or we know whether or not there are things occurring that we don't know about, better to be safe than sorry. And again, that's the entire team, front office people, sterilization crew, our great hygienists and our dental assistant teams. They have to be protected. That, our dental family plus our patient families need to be helped. And control, we have to control the potential problems. We have to give a feeling of confidence. Our patients at the college feel confident that we are doing everything that we can to protect them. Self-monitoring on a daily basis, taking your temperature. The use of these thermometers. Right now, we look at the evidence-based a lot here. There's no real good evidence that shows that thermal thermometers are really doing anything. You really need to take an internal temperature on a daily basis to make sure. So they're really fun-looking gadgets, but our clinical affairs dean, associate dean, Dr. Tyke, has always said this thermometers aren't worth anything. That's why we don't take temperatures. There's no validation of them being consistent from person to person. I walked into stores, they've taken my temperature, and my temperature comes out at 89. I'm a hot-blooded Italian. There's no way in heck that's right. So there's they look at me and they go, are you alive?
You're hot.
Last time I checked, yes, but I'm supposed to be 92. I'm supposed to be whatever. It's just ridiculous that I can't ever on any of these thermal scans ever get an accurate read. It just hasn't happened so far. So we
appreciate that.
We attempt to follow the evidence wherever wherever it leads us. The evidence is going to guide us, and that's what we have to do here. We have to do everything evidence based and logic based. There's a lot of stuff that's speculation, and okay, that's cool, but where's the validation of the speculation? So we need to make sure that happens. And that's the way I've always kind of done things in my private practice prior to coming to the university. When they asked me to come here, I'm like, are you sure you're making the right decision? And I guess my chair doesn't feel that it's the wrong decision. So she still keeps me here, and my dean still has me around. So I guess I'm okay so far.
So the aerosol issues there. The other big thing is spray, spatter, and splatter, or droplets. Because when in speaking with other clinicians and speaking with the hygienists who've been on the program, with doctors, there's a lot of spray that comes out. There's spray, spatter, splatter, all basically droplet form. What is from a medical university and the college of dentistry, what is the context around that? How are you also mitigating or managing that?
Sure. We published a paper in Quintessence International a month or so ago on our experiments on mannequins. First, with just running the handpiece in the oral cavity of a mannequin and seeing what the spatter and the aerosolization goes. And we found that you can, every device that we use always needs a secondary HVE. All of them, every single one of them. In a new paper that we're trying to publish right now, again, we investigated 13 different mitigation strategies, and we found that the most important thing you can do is always to have a secondary HVE associated to reduce your spatter, because the spatter does get all over your face shield. That's when it's all coming back at you. So if you're finding that your face is filled in your face shield, you need a windshield wiper, you may want to consider putting in a secondary HVE along with the initial one that you have in there, or double HVEs can work very well if you're using rubber dam. That'll keep the aerosol down, that'll keep the spatter down completely. So in our studies, we were able to find, the next paper that we hope to have published soon will show the statistics as to our testing, but we are employing all of those tests, the things that we found out at the college. So we're reducing spatter and aerosol significantly. Almost to 100% in some situations.
And I need to ask, because we work Xyrus, you use the isolate in the clinics.
We
Is that
do.
helpful?
It is very helpful. Our students love it. When we introduced it shortly after I got here, because I was the instigator that asked, that inquired and tried to get that here at the college, and the students love it. Our professors love them. Again, secondary HVE along with them is critical. Because unfortunately, even with the Xyrus product, with the Isovacs and the Isolites that we have, there is some spatter. So we recommend keeping the HVE within 2 inches of the operating area. So we have all our students pairing up nowadays. So the assistant student is there with the HVE very close by where the procedure is being done. And for our hygienists, since they typically work by themselves, we've adopted the contraptions in which it has the umbilical, the whole thing's onto. This is where they can position the HVE along with the isolation device that they're using close to where they're using their ultrasonics. And that helps a bunch too, because unfortunately, some offices can't have a second person sit with a hygienist, even though it's probably a really good idea, but these extended arms that can hold the HVE devices in place and move as the hygienist moves while working with the isolation devices is extraordinarily helpful and will reduce spatter and aerosol significantly, almost down to zero, which is really very.
That is good. The context of safety is huge, because if the clinicians don't feel safe, patients feel that too. So it's great to hear that it's multiple layers. That's what I'm taking away from here. It's making sure that you're doubling up, and then the idea that, hey, err on the side of caution, and until something comes. That's huge. How did you overcome the I'm going to call it fear or the anxiety that patients had? Because obviously they're not as plugged into the information, the research, the technology. How did you overcome that with regard to the population that come to the dental school? What was the process that you used there?
Communication with our patients and the community at large has been very, very huge. Here in South Carolina, the medical university is essentially the main source of so much information and so much beneficial that goes around. We have other great institutions also in our community, but MUSC has been the preeminent area that people rely on. What we share with the community in general builds that trust. If the MUSC College of Dental Medicine is telling you that it's safe to come to the dental clinics for us to take care of you, you're safe. There's no question, because our students are monitoring themselves, our staffs are monitoring themselves, our faculty are monitoring themselves. If we're not feeling well, people are staying home. Basically, bottom line, if you feel, don't come in, stay home. Feel better. Because the overall symptomology of Povid is really peculiar. We've never seen anything quite like it, that basically you could, it's the subtlety. The symptoms are so subtle. It can be this slight headache that you have for 3 or 4 or more days. It can be this diarrhea. It can be this upset stomach. There's so many weirdnesses that go on here that it's not like the flu. The flu, one day you're okay, and the next day you're knocked off your feet. With COVID-19, because of the uniqueness of this particular madness that we're in, you err on the side of caution. If you're having a cough, if you've got a sore throat that's bothering you and lingering and keep on hanging on, maybe you should stay home for a day or two until it either clears up or you have a consultation with your physician, so that this way you can determine if a test is necessary. And hopefully, as we go forward with the 15-minute test that Abbott has come out with, it's going to be spread throughout all of the school systems throughout the country soon. I know the MUSC is making them available for all of the school districts in our area of the world. We're going to be hopefully employing those here at the college as well. So there's a lot of good things that are going to occur. We just, we have to just continue to stay strong, stay smart, and keep on finding better ways to manage this. And don't cut any corners. This is not the time to cut any corners to save a buck here or there. This is where you spending the extra dollar, as long as you're not gouged by the dealers that are they're selling us all this stuff nowadays. We can make it through and we can survive. Our patients are smart. They know when something's fishy. You can't cover that kind of stuff up. That's something that I learned long ago. Exactly. It's not a good thing. Your patients trust you. And if you're doing things in the correct manner, your team trusts you. If you're going to put them in jeopardy to save $1 or $2, are you doing them a favor? Are you doing anybody a favor? Are you potentially harming the profession? Are you harming your practice that you've spent so much time and energy to build? This is the time to be effectively the leader of your office place where you are and help your staff know that you're there doing what's right for them. That's critical. Super.
That is so cool. So I'm curious, based on it, it's so cool to hear all the things that you're doing and all the things to ensure. Are there, or did you run into, as you were implementing, researching, and evaluating the different approaches, are there any things that you would not do, that you would recommend, hey, folks, here are a couple things that we ran into that seemed like a good idea at the time, but quite frankly, I mean, you already mentioned the thermometer, which is an interesting concept. Is there anything else like that?
Well, we didn't go out and purchase new equipment. That's the first thing, because universities as a whole have a very limited budget, especially dental colleges. Our budgets are very, very tight. So we had to look at what was going to be the most effective thing given what we had and what did we need to invest in to make sure that we had a reliable possible mitigation effect. And so basically consolidated the types of disinfecting products that we use. We didn't get 15 different types, and we kind of consolidated it down to one basic type that we felt comfortable with. We tried to get something that had a short action time, typically 2 minutes, 3 at the most for disinfectants. We added in extra HVE hose lines. That was relatively inexpensive and effective. We've been looking at how here at the college we're going to continue to improve our airflow. We're still in the process of improving that, which is a really important thing. Face shields. Face shields were probably the smartest thing that we did. I always worked with the face shield in private practice because Karen wouldn't let me otherwise. I blame everything that's good that's happened in my life on that nice lady. She basically, did that. How we got started with Isovac. I told you the story long ago. Again, I kept on putting it off, and then finally did it. And then I walked up to Tom at a later meeting that I was at. I said, "Remember me, stupid? I didn't get this." And it was one of the best things
because of Karen.
It's all because of Karen.
I love that lady
because she kept on bugging me, and again, I'm so much better because of her, and that's the bottom line. We're only as good as the team that surrounds us, and I've been very fortunate to always have a great team, and the captain of my team has always been Karen. She's always given me right guidance as we've gone forward. I can't do it without the team here at the college either. We've got an incredible group of people. Wally Renee, Soren Teich, our Dean Huja, Marty Steed, and Betsy Pilcher, and Tariq Javed. We've got some remarkable folks, Monica Cayoette. These are outstanding individuals here at the Medical University of South Carolina. This college is remarkable, and we pulled together during really difficult times, as every one of the teams in private practice did during that time period, and that still are possibly doing at this time period. But private practice, dentistry, as we know it, has, again, evolved. We didn't change, we continue to evolve. Every crisis that we encounter, dentistry has been effectively able to overcome the adversity and become better because of what we learned and what we implemented. And that's what this crisis has done. This pandemic has made us smarter, better, and by golly, we're going to get through this, and we're going to be able to effectively make sure that no one thinks of dentistry as a second redheaded child of medicine. We are an important component of medicine. We make your patients healthier by diagnosing and treating the oral disease that can be concurrent with your other systemic problems that are going on. Remember that, my MD friends. Without us taking care of the oral cavity, controlling periodontal disease and decay, you can't manage the rest of the systemic problems effectively. We're critical. And this is what this world is all about. Team effort. If we can get everybody to act as a team, we're going to be in a heck of a lot smarter place than if we're just continuing to be adversarial and butting heads. It's just crazy to do that.
That is so cool. I so appreciate that. If you were to sum up, or if you were to kind of bring this together, kind of as a closing statement with regard, I could spend so much more time talking with you, and maybe at a later time, because there's so many other areas I'd love to get your perspective on. But right now, if you were to sum up kind of where we are today and what we need to do going forward, what would that message, what would that sentiment be?
The most important thing, the most important thing, Orlando, is we need to use good science with what we're doing. There's a lot of good work being done out there. Good common sense. If it doesn't feel right, don't do it. If proper PPE for everybody is important. Don't cut corners. Use a secondary HVE with your isolation practices. That's a very inexpensive and easy way to do things. Rella talked about that with a regular HVE tube onto the end of it. That works. 2 of those are better than 1 of those, and certainly a heck of a lot better than none of those. If you're using an ISOVAC or any other kind of oral evacuation system, again, keep that second HVE within 2 inches or closer to the operating area that you are. That'll mitigate everything. Wear a face shield. Wear a face shield. Get good magnification on your glasses. Wear a head covering, especially, the glare off of this thing can blind people some days. Wear a head covering. Wear scrubs to the office and change before you go home. Don't take that stuff home with you. Put it into the laundry and get it cleaned. Just do smart things. Have your patients feel like they are number one. Have your staff feel like it is the most important thing in the world, because you know what, folks? They are. Without our team, we are not very much. We're not that good. We need a team around us to make us better, and that's been my goal, and it's been my statement for as long as I've been practicing and now been teaching. My students are very important. My family is very important. My profession is very important, and I want us all to be safe and take the steps. And if you reach out to Orlando, if you have any questions, he'll forward the messages to me. I'll get back to you as quickly as I possibly can to give you some fair, reasonable assessments, unbiased, because I don't have a dog in the hunt any longer, which is really kind of nice.
First of all, thank you.
I've always spoken my mind, as you well know, Orlando, but basically,
No, I love it.
It's the reality here is that I'm working for everybody nowadays, not just for specific agencies or anything like that. My job is to provide good, balanced, fair assessments, and that's what we do.
Thank you so much for that. I love that. Just do what makes sense. Make sure that you're not freaking out about stuff, and patient, your safety, your team, number one. So thank you for the message. I really appreciate it. Hey, thank you for taking the time to spend with us. I know that you're incredibly busy. I know you're about to publish some more information, another paper. I really appreciate you expressing your perspective, and you're very direct about it. Folks, those of you if you have questions for Dr. John Comisi, please send them to us. We'll be happy to forward those on to him and make sure that he gets those to that. Check out the Medical University of South Carolina School of Dentistry. It's an incredibly progressive and a really, really, when you look at the programs that they have in there, and when you look at the James B. Edwards College of Dentistry, with the connection to the medical side, it's a phenomenal thing. Dr. Comisi, at some point here, we're going to be several months into this. Would you be willing to join us and then share with us what ended up being real and what ended up not?
It would be a pleasure and an honor to do so.
Awesome. And it's always a pleasure speaking with you. I love the directness that you have. There's a real caring that I feel, and it's also really cool that you only talk about what you know, and if you don't, you say, hey, I don't know, let's go find out. So
Yep.
Hey folks, if you like this, please share. If you have any questions, please. Did I disappear?
You've been fading a little bit in and out.
If you like this, please share. If you have any questions, please let us know. Thank you for joining us. Have a great rest of your week. Please be safe, Dr. John.
Thank you. Bye.
Appreciate it.